towards you?
It's no.
Oh, it's to us. That's great. Okay. Okay. Knock, knock, knock.
Come in.
Hi, I am Paige. I'm going to be the PA taking care of you and doing the neuro exam on you today. Is it okay if I proceed?
Yep.
Perfect. I'm going to wash my hands. Okay. We are first going to start by assessing the patient's mental status. So we are going to be assessing their physical appearance and making sure that their behavior is appropriate for their age, their gender, and their situation. We're going to then move on to the cognitive abilities. So we're going to be assessing state of consciousness in response to questions. So do you know who I am today?
Paige.
Okay. And what role am I in today?
My PA.
Perfect. Okay. And then do you know what today's date is?
June 13th.
Okay. Do you know what year it is?
2025.
Perfect. Okay. Then we're going to move on to the arithmetic ability. So I'm going to have you start at 100, and I want you to count back by 7 if you can.
93, 86, 79.
Okay. Perfect. Okay, now we're going to assess your memory. So we're first going to start by assessing immediate recall. So I'm going to give you 5 numbers. I'm going to have you try to repeat them back to me, okay? 51542.
51542.
Perfect. Okay. Now we're going to do recent memory. So I'm going to give you 3 objects. I want you to repeat them back to me, and then I'm going to ask you to repeat those again in a little while, okay? So apple, table, and penny.
Apple, table, penny.
Okay. We're going to assess the remote memory. So do you know where you were born at?
Neely, Nebraska.
Okay. And what is your date of birth?
10/25/1984.
Okay. And do you know what your mother's maiden name was?
Krejci.
Okay. Okay. Let's go on to assessing their judgment and reasoning. So we're going to assess practical first. Do you know what you're doing tomorrow night? What's your plans?
Wakeboarding on the lake.
Oh, that's great. Okay, and then I'm going to ask you just a strange abstract scenario, okay? So if you were walking along by a mailbox and you saw letters laying on the ground next to the mailbox, what would you do?
I would pick it up and probably put it in the mailbox.
Okay. Do you remember what those 3 words were, objects that I told you before?
Apple, table, penny.
Perfect. Okay, so that's us reassessing her recent memory. So if any of these on this portion of the exam were abnormal, then we would move forward with a mini mental state exam at this time. Okay. Let's move on to the cranial nerves. So first I'm going to have you close your eyes for me. I want you to close one nostril for me, and then I want you to tell me what you're smelling.
Nothing.
Good. Okay. And then include your nostril on the other side, and tell me what you're smelling.
Also nothing.
Great. So that would be cranial nerve 1. We would test each nostril unilaterally if we're suspicious for any kind of olfactory complication. We're going to move on to cranial nerve 2. So we would use the Snellen chart for far vision, which we have already previously completed. We would use the Rosenbaum chart for near vision, which we have already completed. And then we're also now going to complete the visual fields by confrontation. So I'm going to get close to you here. I want you to close your left eye for me, or with your left hand. Perfect. And then I'm going to match you. And I want you to just tell me when you can see my fingers come into your field of vision, okay?
No.
How many fingers am I holding up?
2.
Perfect. Okay, so that's superior. I want you to tell me when you can see my fingers come into your field of vision.
No.
Okay, how many fingers am I holding up?
2. 3.
That's good. That would be temporal. Okay, and then tell me when you can see my finger come into your field of vision.
No.
Okay, how many fingers?
2. 1. The gloves
Are you
are throwing me
okay?
off. Take the gloves off.
Okay, and then tell me when you can see my finger come into your field of vision.
No.
How many fingers?
2.
Okay, and then that is nasal. Okay, let's do the same on the other side. Oh wow, that is really right on this side. Okay, and then same on this side. Tell me when you can see my fingers.
No.
How many fingers am I holding up?
3. 2.
Okay, that's superior. And then tell me when you can see my fingers come into your field of vision.
No.
Okay, how many fingers am I holding up?
3.
Good job. That is temporal, okay? And then tell me when you can see my fingers.
No.
Okay, how many fingers am I holding up?
1.
And then how many fingers on this side when you can see it?
2.
Okay, perfect. And that was nasal as well. Okay, let's move on to cranial nerve 3, 4, and 6. So we are going to assess your extraocular muscles. So I want you to just keep your head straight, and then I just want you to only track my finger with your eyes, okay? Perfect. Okay. That is extraocular muscles, so let's assess their pupillary size and equality. So I just want you to look just directly at me, okay? Okay, making sure they're not super small or really dilated. We're going to move on to cranial nerve 5. So we're going to first start with the motor function. So I want you to just bite down your jaw. Yep. Oh, perfect. Yeah. And just clench your jaw and then relax. And then clench again. Perfect. And I want you to do the same again. Perfect. Okay, and that's for both the masseter muscle and the temporalis muscle. Okay, let's do the sensory function of cranial nerve 5. So we are going to use, maybe, perfect. Okay, I'm gonna have you put your hands out in front of me, okay, just so I can show you. This is what dull is gonna feel like, okay? This is what sharp is gonna feel like, and then this is what light touch is gonna feel like, okay? So I'm going to have you close your eyes, and I'm going to be doing those to your 3 sections, ophthalmic, and then maxillary, and then mandibular on both sides, okay? So first we're going to start. I'm going to put your hair behind your head here. Okay, tell me what you're feeling.
Light touch.
Perfect.
Sharp.
Perfect.
Dull. Light touch. Sharp. Dull.
Perfect. Okay. And again, that is ophthalmic, maxillary, and mandibular regions. Okay. So now we are going to do corneal sensitivity with a wisp of cotton. I'm going to have you look right at me. Okay. That's the Cerebellar reflex as well. And then I'm just going to have you look straight ahead if you can. And I'm going to pull just your eyelid down just the ever so slightest. Perfect, okay? That's the corneal reflex on that side, and I'm going to have you just look straight ahead again. Damn. Okay, and that is corneal sensitivity. Okay, we're going to do cranial nerve 7 now, so we're going to do their motor function. So I'm going to have you raise your eyebrows for me. Okay, I want you to smile. Show me your teeth, perfect. I want you to puff your cheeks out. And then purse your lips, and then I want you to squeeze your eyes shut and don't let me open them, okay? Squeeze them shut really tight. Okay, perfect. Awesome. Okay, we're going to do cranial nerve 8, which would be assessing their hearing. We have already previously assessed the whisper, the Weber test, and the Rene test, so we will not be completing those again since they were already completed. We are going to assess now cranial nerve 9 and 10. So I'm just going to have you look at me. I want you to open your mouth for me. You say ah. Perfect. I would typically get a light to do that. That way you can actually look at the soft palate. So I would be grabbing the otoscope off the wall, doing the same thing. Perfect. Okay. And then we are going to have you shrug your shoulders against resistance. So I'm just going to have you relax, and then I want you to shrug your shoulders for me. Perfect. And then relax. Awesome. And then I want you to try to turn your head against my hand. Okay. And then same on this side. Good. Awesome. Okay, now we're going to have you, I'm going to grab the otoscope again. So I'm going to have you open your mouth for me. And then I'm going to just look at your tongue at rest. And I'm going to stick your tongue out for me. Perfect, looking for any fasciculations or deviation. And then we're going to have you push your tongue against your cheek on both sides to see the strength here. So push your tongue against the cheek. Perfect. And then same on the other side. Awesome. That was good. Okay, we're going to move on to proprioception and cerebellar function. So we're going to first start by having the patient remain sitting. So we are going to test the coordination with rapid alternating movements. So I'm going to have you, we're going to do upper extremities first. So I want you to put your hands down on your lap like that. I want you to flip them over and then flop them back. And then I want you to speed that up and do as fast as you can, okay? Faster. Perfect. Okay, that looks good. Now we're going to do your lower extremities. So we're going to have patient tap the balls of your feet onto both of my hands, okay? So I want you to tap, 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 tap. Perfect. Okay. Looks good. Okay, now we're gonna move on to the fine motor skills and accuracy of movements bilaterally. So what I'm gonna have you do is I want you to take your right index finger and put it on your nose. Okay, I want you to take your index finger and then touch my index finger as well. Back to your nose, back to my index finger, back to your nose, back to my index finger, back to your nose, back to my index finger. Perfect. We're gonna do the same on the other side. So left index finger to your nose, and I want you to touch my finger. Yep, back to your nose, back to my finger, back to your nose, back to my finger, back to your nose, back to my finger. Perfect. Okay. Doing 4 spots with that. And then we're gonna do the lower extremity. So I want you to take your right heel, put it on your left knee, and I want you to slide it down your shin for me. Perfect. I'm gonna have you repeat that. I'm gonna have you put it right on your knee cap and then slide it down your shin. Perfect. We're gonna do the same on the other side. So left knee, or left heel on your right knee and slide it down your shin. Perfect. Okay, we're gonna do the standing portion. So I'm actually gonna have you stand up if I could. I want you to put your feet together like this, okay? I want you to put your arms out to your side, and then just keep your eyes open. I'm gonna make sure that they are pretty steady. Okay, I'm gonna have you close your eyes now. And then usually we assess this for at least 10 seconds at minimum. Okay, great, you can open your eyes. I'm gonna have you step on this green box here, and I want you to just take a walk forward just with a normal gait for me. Perfect, and then I want you to turn around, and I want you to come back to me the same way. Okay, that sounds good. You could also have them walk like heel to toe out in clinical practice as well. All right, let's do sensory function. Okay, all these tests are going to be done bilaterally while the patient's eyes are closed. So first we're going to be testing the primary sensory functions of hands, forearms, lower legs, and feet. So we are going to do the superficial touch and sharp and dull again, okay? I'm going to have you put your hands out for me, and I'm just going to remind you again, this is what dull feels like. Okay. This is what sharp feels like. Okay. This is what light touch feels like. Okay. And I'm going to be doing that to your hands, your forearms, your lower legs, and your feet. Okay. So I'm going to have you uncross your feet, and I just want you to close your eyes and then tell me which one you're feeling. Okay.
Light touch. Dull. Sharp. Dull. Light touch. Dull. Sharp. Sharp. Dull. Dull. Sharp. Light touch. Sharp. Light touch. Dull. Dull. Sharp. Light. Dull. Good.
Okay. I think when we're doing this, I want you guys to do 1 on each forearm, 1 on each hand, 2 fingers, and then I want you to do 1 on the lower leg, 1 on the foot, 2 on the toes, okay? 2 on the fingers, 2 on the toes, 1 on the other places, okay? You can just alternate between each. Okay, let's do vibratory. So I'm gonna have you close your eyes again, okay? And I'm gonna put a vibrating sensation on one of your digits, and I just want you to tell me which one I'm doing that on, okay? So I'm gonna have you close your eyes for me.
Third digit.
Perfect.
Pinky finger, left hand. Thumb,
Which hand?
right hand.
Perfect.
Index finger, left hand. Fourth digit, right foot. Second digit, right foot. Toe, left foot. Fourth digit, left foot.
Good job. Awesome. So the vibratory is just the fingers and toes. Then we're going to do joint position, okay? So same thing, I want you to just lift your arms up just a little bit for me, and I want you to keep your eyes closed, and I'm gonna want you to tell me if I'm putting your hand or your finger up or down, okay?
Up.
Which finger?
Fourth digit.
Okay.
down, third digit, left hand,
Good.
up, index finger, right hand, down, pinky finger, right hand.
Perfect. Okay. Have you uncross your legs for me?
Down, big toe, down, third toe,
Good.
up, third toe, third digit, second digit, down, second digit, left foot.
Perfect. Good. Okay, that is joint position. So now we are going to do primary sensory function, and we're going to be doing stereognosis. So I want you to just hold your hands out for me, close your eyes, and I want you to tell me what object I'm going to put in your hand. Okay?
It's a coin in my right hand,
Okay. And then what about on this side?
keys, left hand.
Perfect. Okay. And then we are going to do, so I'm going to have you open your eyes. Well, this is what I'm going to do now. This is going to be 2-point discrimination, okay? So I want you to, this is what I'm going to be touching you like. This was going to be 2 points or just 1 point, okay? So I just want you to delineate to me if you feel 2 points or if you just feel 1, okay? So close your eyes for me and just relax your hands, yep.
2 points,
Okay.
1 point, 2 points, 2 points.
Good job. Okay. Did we decide we're just doing those on fingers? Or
Yeah.
are we doing that other places
We
as
can
well?
just do fingers.
Okay, just fingers for that one, okay? Okay, we're gonna do gravesthesia now. So I'm gonna take the end of a cotton tipped applicator. So I'm gonna draw a letter or a number in the palm of your hand. I just want you to tell me which one I'm drawing, okay? So close your eyes for me.
4,
Good.
8,
Perfect.
3. Did you do a letter?
I did the pound sign. Okay.
6.
Good job.
Got it this
Okay.
time.
All right, that should be it for sensory function. So we will move on to the reflexes now. Oh, yes, monofilament, let's do that. Okay, we are going to,
I
I'll
just
do-
am having that say, or add, perform monofilament exam.
yes, so at this point, we're gonna have you do monofilament exam on both sides, okay? So, I'm gonna have you close your eyes, and all I want you to do is just tell me when you can feel my touch, okay?
Okay.
Let me show you on your hand. This is what it's gonna feel like, okay?
Okay.
Okay, close your eyes for me.
Yes. Yes.
Oh, wait a minute, I'm messing up. Sorry, guys, ignore that, okay? We're gonna start over.
Yes. 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 Yes.
Okay, perfect. We're gonna do the same on this side.
Yes. 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 Yes.
Okay,
Yes.
perfect, okay. That is the monofilament portion. Okay, now we're moving on to reflexes. So first we would start by testing the superficial reflexes. So we have previously done the abdominal reflex in our abdominal portion of the exam. So we will forego that one today. The cremasteric reflex will be tested in the male GU exam. So we will bypass that one today as well. We are then going to do the plantar reflex. So I'm just gonna have you just relax your foot for me. Just like that. You're gonna go up like a little candy cane portion. Perfect, okay. Same on this side. Okay, perfect, that looks good. If they were to dorsiflex the big toe, that would be an abnormal finding like that, okay? We are going to then do the deep tendon reflexes. So we are first going, and we're going to do this bilaterally. So we're first going to start with your biceps. So to start off, I'm going to have you flex your bicep muscle for me, just like that. Perfect. I'm going to find right where it's at. Awesome. I'm going to have you relax this for me. Perfect. Awesome. You're just looking for just a little bit of a contraction there. Same on this side. Awesome. Feels good. Okay, perfect. Looks good. Now I'm going to have you just relax your arm, just sitting just like that. Radiostyloid, you're going to go about 2 inches above that. Okay, perfect. Same on this side. Just going to have you relax in the right location. Perfect. Awesome. Looks good. Okay, now we're going to do the tricep. I'm going to have you go out like that and just relax your arm. Just dead weight. Yep, relax, relax. Perfect. Okay, well, she doesn't have one, so it's in the right spot. You're also probably thinking about it, so. Okay, just relax this one, yep. Okay, perfect. Okay, I'm gonna have you uncross your legs. Now we're gonna do the patellar reflex as well, so just relax these ones. Just gonna find the right landmark, find the patella tendon right there. Perfect, okay. Now I'm gonna just relax, find the patellar, relax, relax. Perfect. Watch out. Looks good. Okay. And then we're going to do the Achilles reflex as well. So just keeping them at like a neutral position like this. You're going to find the right landmark location. Okay. Awesome. I keep my hand up below their ball of their feet. That way I can feel it when they're plantar flexing down with this reflex as well. Okay. And then last one we're going to do is testing for any clonus. So I'm going to have you just relax your leg like that for me. Okay. Okay, looks good. And that is the completion of my neurological exam. Thank you so much for being my patient. That is it.
GoPro, stop recording.